Fine, thank you.
Awesome. Um, we're going to be talking on today's show about sickle cell anemia. And I want to invite my viewers or our viewers to please invite somebody and subscribe and like and share, please. So other people get to learn about this disease. We're trying to create an awareness about the sickle cell anemia because it can save somebody's life, just the knowing of it. Okay. So I know you've had some experiences with this thing, and I want you to talk about it. Let help me express what sickle cell anemia is.
Sickle cell anemia is a it's a red blood cells, abnormal red blood cells that can be inherited from each parent. So it's a hemoglobin, it's a form
Mm,
of anemia. Okay. So the cell generally is like in a round shape, but the sickle one is in a
mhm,
sickle shape. So that makes
mhm,
it abnormal. So when um, a person inherit one from the mother and one from the father, then
mhm,
it becomes a disease. Okay, so now we have types of sickle cells. We have
mhm,
the SS, which is the severe one, and we have the SC, and then
mhm.
the AS is just a trait.
Okay.
Okay, and people that normally get this are mostly Africans, but then it
Mhm,
can be in other areas like we have people in the Arabian Arab area, people
mm,
from Greece, India, Spanish
mm.
speaking. We've had some from that area, but it's not as much as
Yeah,
those in.
yeah. But
So go
because
ahead.
it's a blood disease, um, and the bloodline, you know how people go do their ancestry stuff, to check their bloodline, and then they find out they are mixed with different races. Same way the sickle cell is transmitted is a blood-borne disease. So it really does cut across all races.
Yes, yes.
Okay.
And so the sickled cell,
Mhm.
the cell that it's supposed to carry oxygen. It carries, I mean, the cell itself carries oxygen,
Yeah.
but because the cell is sickled, it's
Hmm.
not carrying enough oxygen, and then
Mm.
it doesn't pass through the vessels
Hmm.
properly. It
Mm.
also mutates, and then it replicates so fast. The normal red blood cells replicate like the lifespan is like every like 120 days, but for
Hmm.
sickle cell is like 10 to 20 days, something to that effect.
Oh, yeah.
So and it's weak. It doesn't carry enough oxygen, and so then
Mm.
it flows because it mutates. It flows and it just clogs up the arteries, the veins, and then
Mm.
it causes a blockage. And so whenever there's a blockage in a particular area, then they experience pain in that
Mm.
area. So
Yeah.
I mean, it clogs up by the knee, then they'll have knee pain, and then
Mm.
the next minute it can be the back, it can be the
Wow.
shoulder, it can be the
Mm.
chest.
Mm.
It goes
So
with
it's pain the only symptom that they get to experience.
no, pain is not the only symptom. They experience there's a thing called bilirubin that's produced in
Mm.
the liver,
Mm.
and but they have excess of it, so it spills into the bloodstream,
Mm.
causing have yellowish eyeballs, their nails are
Mm.
yellow, stuff like that.
Mm.
So that's not
Mm.
a symptom. And they can have
Mm.
all because they don't have good circulations. It can cause
Mm.
also the extremity area, you
Mm.
know. Yeah. And then yeah.
Mm. Okay.
And uh,
So, but
it
go
also
ahead.
have it also can cause enlarged heart. It causes a lot of damages.
Yeah.
It can
Yeah.
cause enlarged heart. It can cause all it can affect all the organs basically.
Wow. Yeah. Because it carries oxygen. No, the red blood cell is supposed to be carrying oxygen. So a full, healthy red blood cell circulates oxygen to the entire body, for normal people. But when people with sickle cell anemia, it's like having a deflated balloon, and you're wanting it to do what a full circle does. It's like trying to roll over a half moon, for example, right? And where a full moon or like a circle, like an orange, you can roll an orange on the ground, but a half orange, you cannot roll it on the ground. See? So something like that. And like that, if you try to roll it and a whole bunch of the sickle red blood cells kind of meet at one place and they're not able to roll over, then it causes some, terrible pain, inflammation, and this pain is very disabling,
It
very,
is.
very disabling.
Yes.
And another thing too is anemia. They become anemic, right?
Yeah. They
Patients
become
with
like,
sickle because they
that,
don't have the red blood cells like other people, and they're going to be needing things like iron, right?
yeah, and then folic acid, some vitamins that they can take. They always have to consult with their doctor to know, the plan. There are other medications that are out there that they can take of them, because I see there are some medications now that they prescribe to prevent the blood cells from replicating so fast. Because it replicates, it doesn't carry, it doesn't carry enough oxygen, it dies fast. So this medication can prevent it from doing that. And there are other medications that are in the market right now that they can use for that. So basically, with sickle cell people, they always have to avoid stress. They always have to avoid stress, too hot, an environment that is too hot or too cold. They can't do strenuous exercises, climbing the mountain, stuff like, because they don't have enough oxygen like that to do that kind of. So that can be a trigger. And then they also have to avoid, I already said that, climbing the mountains, right? Yeah, they have to
because of the oxygen levels.
Altitude.
Lower oxygen levels on the mountain tops. Oh my goodness. Wow.
They also just avoid infection, hand washing. Basically, to live with sickle cell, you have to develop a lifestyle of hydration. You drink a lot and just do all the and want to avoid stress and stuff like that. Yeah. To have a lifestyle for it.
That's true. So I remember you said something about having family member that was affected by this disease. So how did you guys deal with it? Some people think they underrate the severity of this disease.
Yes. In my family, I come from a family with sickle cell. I also have the trait, and I have siblings that had it. So I have one that had the SS, which was the severe one, and then I have one that had the SC, which was the less severe one. So with the SS, we already know that is the two sickle shaped one, and then with the other one is one sickle, and the other one, the C, is not that, so not that severe. So so with the difference with these two is the one with the SS always have crisis, but the one with the S may only have crisis once or twice a year. So in the process of taking care of this children, if a parent, it's like you can't ignore the other one. It's like because you're always focusing on the
one that has a crisis all the time.
So, but the thing that I noticed is in my situation, personal one, is the one with the severe one lived longer than the one with the less severe one.
Wow.
Because the one with the severe one always had the blood transfusion and a lot of treatment and a lot of attention and stuff. And the other one don't have attention like that. and they might be minimizing their own crisis too, thinking, oh, the other one, you know. So yeah, so it's like they have to always watch out for the other one too. It's like be an eye for your child too, you know, so that don't ignore the symptoms.
Yeah.
And you know, in a family that have, when you have multiple children with sickle cell, a lot of the children suffer anyway. Yeah, a lot of children. So the other one that and so somebody like us that didn't have the crisis or the, you know, the illness, yes, you know, you don't get the attention or the you want, you know, from a parent, because they look at you like you're a normal child. So when you're going through your own phases of life, you know,
but you still carry the traits anyway.
They carry the trait, and then you have empathy too for people that have this disease. You know, you have empathy because firsthand, I mean, I know I was the one that would massage the knee, the back, step on the back, step on the chest, do little chores. You know, I was a little helper to help, you know, with stuff like that. You know, you've seen where, you know, where and there's a comic part of this though. I have a comic part of this to aid with my sibling. It was like, you know, they always have this folic acid. My dad always give them the folic acid, and then look in Africa then. And the comic part of it is like the younger one will always go to the older one's cabinet to take his medications. Like it was, it was so funny to me. It's like they're struggling on medications.
Why? Because he's sweet or what?
I can't even, because, you know, the one with the crisis always get more of the medications and stuff, because the other one doesn't have crisis all the time. Actually,
so they go take the medicine for themselves, huh?
Yeah, he goes.
Oh my God.
And so that was, I always remember, that's part of the memory that I have about them now, that I laugh about sometimes, or how they fight over their medications and stuff like that.
Wow.
Folic acid and yeah.
Oh my goodness. So would you say to somebody that it's not necessary to check your blood before, or, you know, like to do a checkup before you get married? Because I think that's important.
It is important. It is important. In those days, sickle cell is it's still a disease that, you know, people are still trying to discover, and that doesn't really have the attention that is needed. Even though we have had progress, but you know, in those days, back in the day, at least in my parents' time, they didn't know, they just intermarried, didn't know that areas. So now advisable for everybody, especially if you come from that area, and, you know, to go test and make sure you don't have the trait before marriage. Because having that would just be irresponsible if it's not done.
Yes,
because
I agree.
In my case, I'm a carrier, so I didn't know I was a carrier until I came to this country and I was pregnant with my first child, and then I was told to go bring my husband.
Wow.
Yes, I was literally told to go bring my husband. So they brought
you know, God forbid, well, thank God your husband was not a carrier, because what that could have meant is you're going to be, you know, having kids that are also exposed or potential carriers of full-blown sickle cell patients.
Exactly.
You know, that is not a way to live, because, you know, a lot of times they're frequent flyers to the emergency room because the pain is very excruciating, right? They're always sick with something, you know. So it's always advisable, you know, to find out what your blood type is, you know, before you get married or even have kids.
Exactly. And when you talk about the pain, the misconception about sickle cell, patients with sickle cell and their pain sometimes is underrated. And just for me, just seeing it firsthand growing up, I know how it is as a nurse and how to take care of them, because I could, and this is a story that I have to say, when my brother died in 91, I was already a registered nurse. So, and I came back from bereavement to work, and somebody was giving me a report about somebody that had sickle cell and how that person is a pain medication seeker. And the person that I had just lost my brother. So I reacted. And so when I said, and I, so other nurses, I had to tell that person that I lost my brother this disease, So yeah, so it's like when they say they're in pain, they are in pain.
Yes.
So it's good to be empathetic and just help and assist any way you can. Don't judge, even if and I'm sure a lot of people it's just because of the ignorance and because they are probably used to it. It's more common in Africa, not as common here, even though they have it, but it's not common. So when they see few patients here and there, they probably don't know, and that's why bring awareness to the disease with the pain. And the pain.
Pain is very subjective, and when people are dealing with pain, it is, it's unbelievable for somebody to just downplay another person's pain. And we know, like, diseases like cancer and even the sickle cell disease is very, very excruciating. And so when a patient is in pain and they need their pain medicine, if you've never been in that shoe, don't judge, right? And patients need to get their pain medicine. And I would also emphasize that, sickle cell disease nowadays is not just it's not just a disease for Black people. I remember, walking into a patient's room, doing my discharge planning, and I walk in there, I was shocked because I knew I was going to go discharge a patient with sickle cell disease, only to get in there and I see this patient is white. So it's like, what? And I did not expect that, but yes, there have been some like Indian, so we don't know, people can be intermarried and even have it in their ancestral traits. So it's not a Black disease, although it's prevalent among Black, but it's something that goes, in the bloodline that affects people that if you don't know and you go marry somebody who has a trait like yourself, then that means you are preparing to bring children into this world that will have a lot of pain. You don't want to do that to a child that you would love. Okay.
Exactly.
And when somebody is thinking about getting pregnant just for the heck of it, consider the fact that you might just run into somebody that has a trait, and you too might have a trait. Don't just have babies because you want to have babies. Do your check, do a blood test, and make sure you're compatible. People do adopt too, even for married people, after you figured out, okay, we're married, and now what do we do? They're both carriers, or one of them is a full-blown one that survived and now is married. There are other ways to address it. This is a blood-borne disease that, two people can be carrying. So it's important for every person to check on their blood type. Check on your blood type, because it usually, you don't look like a carrier. And I mean, what do they look like? Carriers look like regular everybody, everyday person. But if two people like you, come to get married, then maybe one would be, healthy, one or two would be carriers, and one or two might be full blown. You see, so it is very important. Let's not underplay it. And I think we'll talk more in depth about this in the future. And if viewers, if you have any question about this, I would like to go along the lines of your questions. So we'll talk about this again sometime later. Don't you think so?
Yes, yes.
Yeah.
Yes.
We'll take some questions about it.
Yeah, there's a lot to talk about,
Yeah.
when sickle cell, because somebody, like you said, I had the AS and I didn't know,
Mhm.
I just believed that God was watching over me, and all that my parent already went through a lot, and kind of by his grace watched over me, and I didn't end up marrying somebody to produce a sickler.
Yeah. Wow.
Yeah.
Wow. Wow. Well, thank you very, 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 very much for your time. And I'm hoping that somebody got something and a light bulb went on for somebody. And hopefully go get checked with your doctor. If you're dating somebody, please make sure you're compatible blood-wise so you don't bring children sick into the world. Okay, I'm sure your child won't tell you, Mom, thank you for giving birth to me because now I live every day in the hospital.
No, yeah, that's true. I have
Yeah.
somebody the child that actually said that to the mother, gave birth to me. Yeah, I don't know what
That's
pain,
yeah.
Yeah.
Yeah. And it's not only the patient, it's not only the child that suffers. This thing goes on through life, but the parent, while they're raising the child, they are in and out of the emergency room, out of the hospital all the time. So nobody wants to live like that. It's not quality of life. Think about it. Plan your life and plan your children to be healthy. Thank you, viewers. And thank you, Mrs. Olemo,
Thank you
for
so much.
your time. God bless you.
God
Have a
bless you.
great, great day, okay?
You too.
Bye-bye. Okay.